Okay, this is Dr. Theo here in Los Angeles, California, and we're going to basically ask the public what their thoughts are on the current healthcare system and find out what exactly they know about chiropractic, the natural healthcare of choice in America, and that compared to the medical model.
What do you think of our current healthcare system?
It stinks.
Profoundly flawed.
Honestly, I think it's a nightmare.
I think it's very expensive.
I think we do need a better strategy.
I have health insurance that used to be paid for through my company. This year they started charging me a monthly fee for myself and my daughter that never existed before. The premiums have doubled. So everything that they say is happening with the healthcare actually is happening to us.
My wife has been denied coverage over here, so basically she can't get healthcare coverage here.
Why has she been denied?
Because she went to the emergency room with pain in her back.
Pain in her back?
Yeah. And they didn't figure out what it was, so now she's like an unsolved mystery, which means that no healthcare providers will take her on.
Did they charge you?
Oh yeah, $34,000.
For my husband for health care, I got him brain surgery.
And was this covered by your healthcare plan?
No.
So what would
He's
you
on
do?
Social Security disability for the rest of his life.
Now, if you got sick all of a sudden, what would you do?
Well, being as a nurse, I would try to treat myself. Call my parents.
Oh, I have to wait 45 days to get seen, and it's for breast cancer, and I know breast cancer is a severe thing, and so like for 45 days I have to go through stress and anxiety, not knowing or if I do, if I don't, because I can't get the proper Medi-Cal or the Medicare insurance that requires to get seen like in a week or two.
So I've gone to clinics, waited online for 13 hours.
My mom's a doctor, so I'll ask her, but
You're lucky.
yeah,
Very lucky.
that's my care.
You're from Denmark, you said.
Denmark.
Wonderful. So can you explain to us what the difference between the healthcare systems is?
The basic difference is that all healthcare in Denmark is free and for everybody, and it's a basic right we have.
What kind of healthcare? I mean, what does it cover?
Everything.
In Australia, we have a system where people they pay a levy of 1% of their wage, and everyone is covered.
The other thing that I do is order a lot of prescriptions online from overseas, which I know is not necessarily what you're supposed to be doing, but it's cheaper. And so if I know she gets sick and she's going to have a cough and it's going to require amoxicillin, instead of going to the doctor, I have it at home because I've ordered it from Thailand.
God, Dr. Theo, I can't believe these answers that are coming out of people's mouths. I'm really surprised at how many people aren't aware of their impact on how they can change their future. Person after person after person, they're all unhappy with our healthcare system.
I totally agree. Also, you'll see that a lot in the office when they come in. They're basically so mesmerized about their possibilities after their eyes are open to what they can do. And when it's opened up and told to them correctly, they're like, wow, I never knew that I could feel this good or be this healthy. What's some of the things that you actually heard that you were like, you knew for a fact that was just like totally off the wall?
As far as healthcare, I think we're a little obsolete these days. I was just laid off in June, it's going by really quick.
Say, something happened right now. What would your immediate plan of action be?
Drink some water.
You don't just take your car in when it needs to be fixed. You have to go and get an oil change. You
do all kinds of stuff to go along with it, and they might like do something to where you have to still keep spending money, so you can't really trust them.
Chiropractors or the medical establishment?
I would say both, basically, yeah.
Got bronchitis this summer, I have asthma, I have all these allergies that are hitting, and it's kind of dry out here.
And do you take any pharmaceutical medications?
My husband sure does, but I get them for free.
You take them?
I don't take his medicine.
No, but you're your own. What is the difference between a medical doctor and a chiropractor?
Chiropractor is paid more.
Do you know what a chiropractor does?
Yeah, I do, but I don't go to it. I walk.
I don't know, it's just everything hitting at once. Of course, when you get laid off, there's nobody to help you out.
We're trying to reach out one spine at a time, as I say, and get the word out there and get people to understand that they can be healthy.
What my chiropractor does is he spends a good portion of the time massaging the muscles to make sure they're flexible, and then he cracks my hips and my back to make sure that everything is in alignment, and ultimately it results in just being less stiff, being more mobile.
Have you ever seen a chiropractor before?
I have.
Were you pleased with your results when you saw your chiropractor?
Yes, definitely.
What do you think a subluxation is?
I don't even know what that is.
Just take all the blockages out of the spine, the subluxations, remove the subluxation, allow the brain and the body to reestablish itself, because the brain knows everything. It does everything. It takes care of diseases, it takes care of cancers, it takes care of viruses. It does it. It heals on its own if you cut it. Understanding this vital, innate intelligence that the body has is what everybody needs to be educated on. And like I said, we're doing it one person at a time.